Good evening, everyone. Here we meet again with yet another episode of BMC Global Live AL-HILAL Health World, Nothing But Lifestyle. This talk show is purely dedicated to addressing all health queries and concern, and every episode features an expert doctor who provides valuable information and advice on various health topics. Today, we are delighted to have with us Dr. Shankar N., the specialist urologist at AL-HILAL Hospital, Manama. He will educate us on UTI or urinary tract infection. Dr. Shankar comes with a wealth of experience of more than 12 years in urology. He's an expert in open urological procedures, andrology, endourology. Doctor, thank you so much for joining us on the show.
Thank you.
Welcome to the show.
Thank you.
So UTI is a common word which we are very familiar with, but
Yes.
still for the benefit of our viewers, could you please explain what it is exactly?
Okay. UTI is a urinary tract infection. It is the inflammatory response of the urothelium to bacterial invasion that is usually associated with bacteria and pyuria. What is bacteria? Bacteria is the presence of bacteria in the urine sample. It is associated with pyuria. Pyuria is defined as presence of pus cells or WBC, that is white blood cells in the urine. Usually in tract infection associated both pyuria and bacteria. The pyuria is also present without bacteria, that is known as sterile pyuria. It is inflammatory response to the bacteria or infection or non-infectious conditions like kidney stones and malignancies and tuberculosis infection. So this is known as sterile pyuria. So both pyuria and bacteria is usually common, but pyuria without bacteria is common in TB, stone and malignancies, and the reverse bacteria without pyuria is also possible, that is colonization of the bacteria without infection of the urinary tract. Again, bacteria is again classified as symptomatic bacteria and asymptomatic bacteria. Symptomatic bacteria means when our patient comes to us with symptoms related to urological tract infection, on investigation it is found, whereas asymptomatic bacteria is done for population or screening tests. It is detected bacterial count and WBC, that is asymptomatic bacteria.
What is the most common organism causing UTI and how does it cause a urinary tract infection?
Actually, bacteria causing the UTI is bacterial infection is the most common. Other causes are fungus and virus can also cause. Among the bacteria, E. coli, that is commonly originating from the intestine, that is normal flora of the intestine, it is present in the rectum, that will cause the infection. It causes around 85% of the community acquired infection and 50% of the hospital acquired infection. And the mechanism is, this is common in females when compared to males because of the close proximity of the anus to the urethra.
Okay.
And urethra also shorter in length, 4 centimeter only, and it is straight course. Whenever from anus the bacteria enters the vagina, then it comes anterior part of vagina, urethral mucosa, then it can easily passes up to the bladder when it might ascends only short length of around 4 centimeter.
So how
And
common is?
actually this mechanism is E. coli will bind to the vaginal mucosa or urethral mucosa. Then it will penetrate the mucosa and enter the genitourinary or renal system, then causes the symptoms related and complications.
So is that the reason why UTI is very common in young women?
Yeah, that is why it is very common in young women. Among the school-going children, it is 1% in women, and young women it is 4%. It is 30% common in young women when compared to men, and after 65 years, it is only 2 times common when compared to men. So young women is most commonly affected, and sexually active young women.
Okay, and what about postmenopausal women? We have seen that a lot of women who are in their postmenopause stage are more prone to getting
Yes,
UTI.
yes.
What could be the
Yeah.
reason behind this?
As the age advances, menopause happens around 40. Some people 45 to 50 years of age. After menopause, estrogen hormone will be reduced. Usually, the vagina is acidic pH, around pH value 3 to 3.5, and this acidic is also supported by lactobacillus, that is normal supporting flora of the vagina. 95% bacilli is lactobacilli. Other normal flora is Coagulus negative Staphylococcus carnibacteria. These lactobacillus produce acidic pH, and acidic pH is useful for survival of this lactobacillus. Both are interdependent. When the age advances, this hormonal change happens. Estrogen reduces, pH increases from 3 to around 5. So the immunity will comes down and lactobacilli will come down. So this bacteria gets space for attachment. So that space become empty when the lactobacilli are destroyed because of the alkaline pH. So this E. coli easily get the space for binding in vagina and urethral mucosa. In that way it enters the urinary tract.
Okay.
And other causes are, as the age increases, pelvic muscles will become weak, and pelvic organs, bladder and uterus comes down. That is pelvic organ prolapse, cystocele, and post-void residue. Also, that is after passing urine, always some urine is remaining in women.
Okay.
In postmenopausal, approximately 100 ml is associated with more chance of infection, and urethra will be narrow in them because of the low estrogen also. So dilatation of the urethra will help for them if the post-void residue is more than 100. That post-void residue is measured by ultrasound. That is why these are all the risk factors of the post.
And doctor, what about pregnant women? Is it important to screen them for UTI even if the symptoms are not present? How important is screening for UTI?
Definitely they need screening for UTI in the first trimester itself. The reason is other normal women, non-pregnant women will not get any complication, but whereas pregnant ladies will get complication, that a very serious complication can happen. Up to 30 to 40% of the pregnant ladies will happen infection of the kidneys, that is known as pyelonephritis. So that is very dangerous complication of UTI. If we miss it, it may enter into the bloodstream, causes septicemia, then and septic shock also it may occur if we don't detect early pregnancy and treat it. So all pregnant lady, irrespective of the symptoms, are asymptomatic bacteria should be treated.
Okay.
This is the reason behind this.
So it's mandatory that all the pregnant women get tested screened for
yes,
UTI,
yes,
whether
yes.
they have symptoms or
Symptoms
not.
are asymptomatic, yes.
Okay. And what are the symptoms that generally patients manifest when they have a UTI, and what are the investigations that you do to treat it?
Okay. So usually symptoms are defined as in the urinary tract, again divided into upper urinary tract and lower urinary tract. Upper urinary tract includes kidney and ureter. Lower urinary tract, bladder, urethra in females, and prostate also comes in males in lower urinary tract. The infection of the kidney symptoms pyelonephritis. These symptoms are blank pain, fever, nausea, vomiting, and if become serious, as I told before, septic shock, very difficult to treat, and inflammation of the ureter known as urethritis. This will also lead to flank pain and other uremia symptoms. Uremia means nausea, vomiting, all those. And in the lower tract, cystitis is the infection of the bladder known as cystitis, and urethra is urethritis. Cystitis clinical features are suprapubic lower abdomen pain, dysuria. Dysuria means burning pain while urination. Frequency, very often tendency to go to pass urine, often 30 minutes to 1 hour. Urgency is ability to postpone the act of urination. That is some people will develop nocturia also because of irritability of the bladder. And when coming to urethra, it is not urethritis. It is caused by urinary tract infection, less common, but STI, sexually transmitted infection, gonorrhea, chlamydia will cause urethritis, leading to stricture or narrowing of the urethra. That will also cause difficulty in passing urine, straining on urination. And overall common urological symptoms, upper and lower, it may be cloudy urine, pus in the urine, discoloration of urine, and blood in the urine, that is reddish color discoloration of the urine. So these are all the overall symptoms of this UTI. Coming to investigation, the first common investigation is urine microscopy, and it is not accurate. whenever the infection that count bacterial count more than 10 power 5, that is more than 1 lakh per milliliter, it will show positive. Otherwise, it will miss the bacterial on the WBCs in the urine. So
Okay.
urine culture is most accurate. It will show accurately how much bacteria. But so depending on this significant bacteria, asignificant bacteria term is there. Asignificant bacteria means after culture, 10 to the power of 5 coloniform unit, that is 1 lakh CFU per milliliter should be there in symptom or not symptom. Whereas in symptomatic dysuria, if symptom is there, 10 to the power of 2, that is only 100 coloniform unit per ml should be taken and treated. Otherwise, if we do urine microscopy, this 10 to the power of 5 only detected, less than or missed actually, then it will lead to further complication.
Okay.
So culture is accurate, and bacterial count 10 power of 2 per ml should be treated aggressively in case of if the symptoms are existent.
Okay.
If the symptoms are not there, 10 to the power of 5 should be treated.
So urine culture test is the most important
Most
step in the
yeah, yeah.
investigation
Yes,
process.
yes. Not only microscopy culture, again further tests are there.
Okay.
If on the treatment resolution happens, resolution means disappearance of symptoms and bacteria. Sometimes it will not. Then further radiological test should be there. First is simple ultrasound to check for the upper urinary tract.
Okay.
And even after if it is still not improving, CT scan and further tests
Further
are
investigation.
necessary. Necessary.
And should patients with asymptomatic bacteria still be treated?
Yeah, as I told before, pregnant ladies should be treated.
Okay.
And other all previous before surgery we should treat.
Okay.
Otherwise after surgery they will complicate and
Okay.
they enter the bloodstream causing septicemia.
So before
septic
any
shock.
major surgery,
Yeah,
whether
yeah,
you
yeah.
display symptoms or not, you should still get screened for
yeah,
UTI.
should get screened and get treated.
Treated for
These two
UTI.
are the important.
Okay. And doctor, you spoke about upper urinary tract and lower urinary tract.
Yes,
So how do you differentiate between these two? How do you know whether you have an infection of the upper tract or the
Yeah,
lower
yeah.
tract? Are the symptoms different or
sir.
is it the same?
Actually, this is localizing the symptoms to the upper tract and lower tract. Traditionally, flank pain, fever, and bacteria are thought to be diagnostic of pyelonephritis. But now only cystitis will present like flank pain, fever, bacteria. So it is accuracy is less than 50%. And on the contrary, when the bladder only involved, in ultrasound it will showing, sometimes it will show kidney involved. So both chance it is there. We should not depend on the clinical signs only. So if we depend on this, we will miss 50%.
Okay.
Either way.
Okay.
If we think lower, it will be involved upper. If we think upper, lower, only it will show like that. So accuracy of clinical signs only is limitation up to 50% only. To get correct diagnosis, we should take investigation with radiological support also necessary.
Okay. And what is complicated and uncomplicated infection?
Complicated and uncomplicated depends on the function and structure of the genitourinary system. Uncomplicated means any infection or UTI in the normal structure and functional urinary system. Normal structure means structure of the the functional first. Functional means neurologically and kidney concentrating ability. That is any glomerulitis, all those concentrating ability will be impaired in the kidney. That is one function. And neurological function, bladder drainage, any neurology, nervous system involved, spinal cord or brain, the bladder emptying will be impaired. These two are the functional. Structural means normal kidney system should be there. The antegrade drainage of the urine, no reverse flow, reflux should be there. Some of the example causing this anomalies of the development, the duplex ureter, ectopic insertion of the ureter, and stones. Normally it causes antegrade, it will stop the blood. And staghorn stone, and male's prostate, chronic prostatitis, and urethral stricture, and urethral diverticula. Some of these are examples of structurally abnormal.
And what is recurrent UTI? Because a lot of patients, once they contract UTI, it's been observed that they have a tendency to again get the same infection. So is that recurrent UTI, and
recurrent
how do you
UTI
treat
is
it?
the one is a type of infection that happens in individual who has previously successfully documented resolution of the bacteria UTI.
Okay.
Now it is again two types of recurrent UTI. One is reinfection. Reinfection is again the fresh bacteria entry into the urinary system from outside. That is the most common in young women actually. One other type is persistence of the bacteria. Persistence means the infection after resolution, it again activated re-emergence from the focus that is present in the genitourinary system. Some of the example for this is complicated UTI like kidney stone, medullary sponge kidney, that duplex ureter, ectopic ureter insertion, chronic prostatitis, all those I mentioned complicated UTI before.
Okay.
All these are causes of this. That is persistence of the bacteria.
And could you tell us a little bit about management of recurrent UTI?
Actually, the recurrent UTI again reinfection and prevalence. Persistent. Reinfection is usually managed if in young women, uncomplicated cystitis or UTI. Only 3 dose short duration of 3 days simple antibiotic is enough. Whereas if it is complicated UTI means in case of males it is some of the conditions are directly considered complicated UTI. In complicated UTI, minimum 7 days up to 1 week, sometimes up to 1 month antibiotic necessary. Complicated UTI examples are males any kidney stone and previous hospitalization after surgeries, and patients on catheter, neurologic patients, and patient presenting at 7 days of presentation, and previously antibiotics already patient took and came back, and pregnant ladies, diabetic, and immunosuppressed patients. All this need more duration of antibiotics. This is the reinfection actually.
Okay.
And persistence is that is previously present that becomes negative after culture. Again same bacteria come that is present before inside our body actually. This need only urological intervention, otherwise it will not go. So it needs intervention. Only surgically we should clear it, persistent, because bacteria will be present in stagnant stone. If it will go and it will be present inside the stone, it may come many times. Till we remove the stone, it will not go. And other anomalies and chronic prostatitis also we should remove and treat completely.
Okay.
And urethral diverticula and abscesses and all this, and some of the other examples are there. Medullary sponge kidney and unilateral atrophic kidney with pus, and renal cyst infected with communicating with the pelvic calyceal system, and diverticula of the bladder and stone, and perivesical fistulas, intravesical fistula, and after nephrectomy ureteric stump will be left behind some length, that also will be focus of infection.
Okay.
We should find out all this. This is the persistence of infection. Here the active urological intervention is necessary to remove the focus of infection. This is about the recurrent infection, reinfection. But reinfection, if again it is coming, the long-term antibiotic prophylaxis is necessary.
Okay.
Young women, middle-aged women, all those, they cannot tolerate symptoms. Such people are given long-term prophylaxis, 6 months minimum dose antibiotic after dinner, night time. One example, cephalexin or trimethoprim, sulfamethoxazole, trimethoprim, or nitrofurantoin. All these medicines can be taken 6 months minimum actually.
Okay.
Some patients were not ready to take this. For them, 3-day intermittent dose medicine will give. So they can take whenever they feel symptoms, immediately they can take it.
Okay.
and they will give the urine sample and culture and start 3-day medicine. When the report available, they can consult the doctor for further management.
Okay. And do genetic factors make a person more susceptible to getting UTI? Does it play a role in
yes,
that?
Yes. Genetically, the susceptibility of the E. coli bacteria binding to the vaginal or urethral or buccal also it is studied. That binding depends on the blood group, Lewis blood group, non-secretory or secretory type phenotype actually. Secretory type are protective of the infection. Non-secretory are more susceptible to this.
Okay. And UTI is more frequently seen in diabetic patients. So why is it so? Why are they more prone to getting UTI?
Diabetic patient, it is already immunocompromised state actually. In diabetes, kidney concentrating ability of the urine is impaired.
Okay.
So when they are unable to concentrate urine, they cannot concentrate the antibiotic also. So antibiotic medicines also will not stay there. So it will difficult to manage UTI. Also more susceptible to papillary necrosis and emphysematous pyelonephritis. These two are the also deadly complications of UTI. So we should treat them before developing to that stage.
And is there any risk associated with contraceptive usage when someone has UTI?
Yeah, contraceptive is definitely increased. Already females are more more susceptible to UTI. If they use contraceptive, still more it is there. Among the contraceptive, diaphragm usage is more risky than other types of contraceptive because diaphragm always it is spermicidal agents are used with that. That is also a cervical cap put on the cervix before intercourse. Actually, this spermicide kills the normal flora, as I mentioned before. The lactobacillus, it will kill the lactobacillus. So after the this spermicide action, the immunity will reduce. So bacteria easily binds and enters the urinary tract. Not only this, the studies are proved even sexual intercourse itself is the risk factor for females.
Okay.
Because when the intercourse happens, the bacteria will be present in the perineum near anus. It will easily enter the mucosa. So they are recommending single dose antibiotic to be taken after intercourse.
Okay.
For both conditions, if they use contraceptive, then double risky actually. So if they are not controlled with contraceptive, they can change the contraceptive. Or if they want to continue, same better to take postcoital. Postcoital means after intercourse, single dose antibiotic. Simple tablet I mentioned before. Same any one tablet they can take each intercourse.
Doctor, could you please throw some light on immunotherapy for UTI?
Okay. This is a recent development in the treatment because even after long-term self-administered or postcoital therapies, it is still recurring and some people are frustrated with the symptoms. As the age advances, it is becoming more and more. So immunotherapy is the E. coli bacterial lyophilized lysate extract of the E. coli is developed. That capsule is available in the market. 6 milligram once daily in empty stomach. 3 months they can take. This can be taken with active infection with other antibiotics or after the treatment of UTI also. 3 months if they take, it will give better immunity and it will activate the innate immunity or body immunity to prevent the further urinary tract infection. That is a bacterial lyophilized means bacterial lyophil means that bacteria is deep freeze, then it enter into the fumes like without entering the solid to liquid, solid to vapors. So that capsule is the E. coli extract.
Doctor, before we wrap up this episode, can you please explain to us in a nutshell whatever we discussed here today and a general message for our viewers on how to prevent UTI?
Okay. Actually, this UTI is very common. Clinical features vary dramatically and it affects all ages and males and females, children, adults, old age, anyone. So we should consult doctors, all risky people. Example, any male infection, children infection, and diabetic, old age, any immunosuppression. We should consult the doctor for early treatment to avoid the complication of UTI. Some precautions they can take, that drinking more water adequately. If they drink, the urine flush out. Even if the bacteria is there, it will flush with the urine. Amount of water at least 2.5 to 3 liter per day. At least 1500 ml urine output should be there per day per person. Then it will wash out. And some precautions they can take before intercourse, after intercourse, cleaning and passing urine before intercourse, and after intercourse passing urine, cleaning the area and wiping anterior to posterior. All this will not study proved to prevent recurrent UTI, but precaution we can take.
Thank you, doctor, for patiently answering all our queries. Viewers, I hope you found this episode very informative and useful. For any urology related issues, please visit Dr. Shankar N in AL-HILAL Hospital, Manama. Our health is our most prized possession, and our bodies deserve to be treated with tender, loving care. So please take care of yourselves. It's time to wrap up this episode. Till we meet again next time, this is Anupama signing off. Stay healthy, stay active, and stay happy.